All these teams are from the Georgian Bay area.
Just under 30 seconds now with the Oro Thunder up 7-2 on the Penetanguishene Flames inside the Flame zone. Oakley Zink shot blocked in front by a couple white shirts. Now 15 left. The Oro parents getting a little bit more hype with the game now being all but one. Is that what scores? Hudson Ferguson with his first. It's 8-2 in favor of the Thunder. And I think that will do it for us here. And that is the game. 8-2 finish in favor of the Oro Thunder over the Penetanguishene Flames. And that does mean that this Oro team, we'll call it the rep team now, will play against the Georgian Shores team we saw 2 games ago in the final tomorrow at 1:15.
That's going to be a good game because that Georgian team is really good. And the Thunder, if they're coming to play tomorrow, they've got some good players and they've got some depth that wasn't as good with Georgian Shores. But I'll tell you, it'll be fun. It'll be fun. Let me tell you, it'll be fun.
Yeah, absolutely. And from this game, if you want to talk about players of the game for Oro, I gotta say Oakley Zinke, the young man.
He only got one
great.
goal in. He's just giving the guy. I agree. Actually, I'm just giving you a hard time. I agree with you. Oakley played so well and got snake bit a bit too. And I'm looking at the shots on goal. They outshot him 23-10 over the 3 periods of hockey, and he was instrumental in some of setting that offense up, coming up, getting some offense from the backside.
Yeah, exactly. That's the thing. He scored the first goal of the game, almost had a second, and he's a defenseman. It's even more interesting. And then Brody McCree had 2. He was really good. Tried to get that hat trick with the between the legs goal. Little show there from him. But really interesting to see that Oro team against the Georgian team we saw win 10-1 earlier. They're going to be a really interesting matchup to see who pulls away in that one.
Oh, there's no doubt. We're going to have some good hockey, minor hockey tomorrow afternoon, and I'm looking forward to that game, especially this one with Oro against Georgian Shores, so it should be good. Charlie Robitaille faced 23 shots that got to the net. He gave up 8 goals, but he made it good for them for a long time before they finally got to him and took it away in the 3rd period. So.
Absolutely, and for Penetang myself, I got to go with probably Cohen Front. He looked really good, got one of the 2 goals for him. I agree, Robitaille was fantastic there for them in net. Obviously let in the 8 goals, but most of them weren't his fault. He lost his stick for one of them. Yeah. He was fighting with the net, and he lost, sadly. But a couple really good blocks there, too, for Penetang. They had quite a few blocks in front of the net, making sure Oro doesn't have a lot of opportunities, even though they had a ton, let alone anyway. But it was a really interesting game for Oro. They played really, really well, and a well-deserved win in the end.
We will. I'll tell you, we will really do. I'm looking forward to doing that game tomorrow. It should be a lot of fun. This afternoon, a special thanks to those folks that put on the tournament to get these kids here to play. Georgian Shores, the Georgian Bay League, to come here and welcome to Owen Sound and let us use our facilities and put on a tournament for you. We're glad to have you. I know the local businesses appreciate you dropping a little coin while you're here too. So, but this is great to have this tournament here at the end of the year, and it's great for Rogers to have it on television, bring it into your living room. We hope you enjoyed it. Again, as much as I like you to sit, watch the games. Come on down to the rink.
Yeah, absolutely. And quickly want to mention that the attack play at 7:30 tonight here at the Bay Shore. Zach Scribner, Mark McKelvey will be doing the broadcast later tonight. But that'll do it for me and Gord here at the Bayshore Community Center in the J.D. MacArthur Arena for the U9 Georgian Bray tournament. We'll see you tomorrow for the finals games at 12 and 1:15 respectively. We hope to see you tomorrow. For Gord Chapman, I'm Spencer Byers. See you tomorrow.
drove a car. And so then the person would talk about their car. And as they're sharing that story, the volunteer is writing the story down. So after their engagement or their time together, and that could be months, that they've actually created a journal of this person's life. It could be, tell me about the first time you danced, your favorite song. It could be, tell me about the first time your first kiss, right? And so they're journaling all of this, and then they, at the end of it all, they give that journal to the individual, which is really, really special to the family, of course.
Yes.
Yeah, so that's just an example of
That gives me goosebumps.
Oh yeah. So what is possible, right? What is it that we can do to make things work and make the person feel good, even though they may not have been able to see us in person?
Yeah. I have a couple of questions. So you mentioned first that funding comes in through donations, that Alzheimer's Society relies on donations. So anyone watching the show or any organization could donate to the Alzheimer's Society, right? How do they do that? How do they do that?
So they're donating to the, what's really important to acknowledge is they're donating to the Alzheimer's Society of Grey Bruce. Because if they donate to the Alzheimer's Society of Grey Bruce, it funds our programs, so that money stays in Grey Bruce to fund the programs that we provide. So that's important. So how can they do that? Well, they can just call us directly or mail a donation in if they wish. So it's either by phone or mail. And they can also just participate. Our big fundraiser is, of course, the Walk for Alzheimer's, and that takes place on May 28th. And this year, because we haven't had an opportunity to do in person for some time, it will be available in person. So, yes. So it'll be available in person in Owen Sound and also in Saugeen Shores, which will be Southampton. And in Owen Sound, it's at the Grey Sauble Conservation Area. And what I would encourage people to do is you can go to our website, www.alzheimers.ca/Grey Bruce. And you'll see how you can go about registering either yourself as an individual or as a team, and just, encourage people to pledge you for your walk. And those donations will go to, as I say, the Alzheimer's Society of Grey Bruce for our programs and services.
So it's a wonderful opportunity as we move through COVID to gather together for a good cause.
Well, so Carol, I thank you for mentioning gathering together, because I really think the emphasis this year will be on the socializing. I do have to share that, a lot of happiness. I was listening to a CBC program yesterday morning, and they were talking about happiness because I think Canada is rated 15th, like the 15th country of being happy, but just bringing the focus back to what makes us happy. So exercise makes us happy, and being with people makes us happy. So, so the Walk for Alzheimer's is a perfect ticket for that. A lot of these, so many of us have been isolated away from the people that we started to really develop great friendships with. And the sad thing about Alzheimer's disease and these other dementias is you start to see these relationships that you once had with your friends may possibly dissipate. They disappear. So you start, when you belong to an organization such as the Alzheimer's Society and start participating in our programs and services, you start developing new friendships. And that is such an important key piece as we travel this journey, that we stay connected. So from my past experience in participating in the Walk for Alzheimer's, seeing like it's all about those gatherings, right? Connecting and hearing people laugh and enjoy themselves. So,
which is excellent. From your perspective, has COVID had more of an impact on Alzheimer's families because of the isolation, because of the lack of contact? From your perspective, are we seeing a more rapid progression of Alzheimer's in the journey, or is it hard to actually make that connection?
Yeah, whether it's a rapid progression, I can't say for sure, Carol. But what I can say is it has definitely opened our eyes to more crisis situations. Just because the care partner themselves hasn't been able to get access the services that they typically would have been able to access. Such a big one is the day away program, right? To have the respite, but they also are the challenge not only to the community programs, but also again, those social connections. So family members who may have or a friend who may have otherwise come around to give them a little bit of respite, wasn't available to do that anymore. And for people with Alzheimer's disease or these other dementias, having a routine is very, very important. So at the beginning of the pandemic, of course, that routine was just squashed. So it just, the individual may not always remember exactly what it is or where they're going on a specific day, but they know if it's a Thursday or a certain day of the week, they're going somewhere, right? So whether it's they're going to a day-away program or they're getting their hair cut or whatever, they know they're going somewhere. So because of that, you start to see, because of that loss or that disruption in a routine, you may start to see a behavior. So then we have to figure out, okay, so how can we channel this to support this person and create maybe a different routine, so can I see, certainly research tells us that social isolation can impact the progression of the disease. So we want to ensure that social connections continue to happen. But can I say that's happening in our clients? Because I'm not a doctor or a researcher, I'm not going to say that. But I can say that certainly the need for support, the crisis situations has certainly escalated.
Right. Sure. So just a couple of things you mentioned, and although it's called the Alzheimer's Society, it is more than Alzheimer's. It is other dementias that you provide services for as well. Correct?
Correct.
It's not just those people who have a diagnosis of Alzheimer's. It could be other related dementias that you provide services for.
And if I can just maybe just clarify those other dementias, because dementia is a symptom. It's a set of symptoms that encompasses a disease. So you have a loss of memory, judgment, reasoning, your ability to function with day-to-day activity. And this is when that's when you should be seeking medical attention, that you're having these symptoms. So you go to the doctor and you find out what is causing these symptoms, right? So the doctor may say, okay, well, it looks to me as though you have dementia. Now, we're not really certain as to what is causing that dementia, so we'll have to do some further investigation. So that further investigation may involve some blood work. It may involve some diagnostic imaging, maybe that cognitive testing may be done. So then they determine that maybe it's depression that's causing it. And if it's depression is treatable. So that's a reversible dementia. But if the doctor determines that, okay, he or she has looked at all these all the test results and determined that, okay, based on what we're seeing, it looks like we're looking at an irreversible dementia. So, Carol, that's what you're talking about when we're with the Alzheimer's Society, is that it could be Alzheimer's disease. It could be Lewy body dementia. It could be frontal temporal dementia. It could be a vascular dementia. So we're supporting individuals with irreversible dementias. So that's important to note. But it's also very, very important to note that if individuals notice something different about their cognitive ability, that they need to seek medical attention, because there is a cause for that, and it doesn't necessarily mean that it's Alzheimer's disease.
Yeah, and I'm so pleased you made that clarification. I think it's really important for people to know that. The other part that I'm gathering from your description is you don't just provide support to the person who presents with the dementia. The role of the society is just as important for those who are providing the care to the person, and that you actually focus on all of those aspects, that you provide resources as well. I'm wondering if you can talk a little bit about, as we move through the pandemic, what resources might be more readily available now. You had talked about Day Away, for example, for respite. Is it going to be open again?
Oh, yeah. So Day Away is already opening up. And I don't think they're right at capacity yet, but it's always changing. So it's hard for me to keep up on where they're at in terms of their capacity, but certainly they have been taking on more individuals. We ourselves, in terms of our in-person involvement, we're hoping actually to do Minds in Motion and our active living programs in person.
Okay.
And we kind of did like a mock run just last week. I think we did this mock run to see how things would go, because we too we rely on volunteers as well to help us. So making sure that we really are following all the guidelines put in place by public health in ensuring that people that participate in our programs are safe, and we're safe too as staff members. So that's where we're at in terms of offering those in person. The counseling support, we continue to do the counseling support over the phone, email, or in person. We can do that in person, or we can do it Zoom as well. So the interesting piece about that, and I do a lot of the education. So as you mentioned, the care partner is a huge part as well in what the Alzheimer's Society, who the Alzheimer's Society supports. So we get people living with dementia and the care partners attending these various learning series that I host or facilitate. And those are offered through Zoom. Now, I guess what, in terms of actually doing that in person, I'm not really sure where we're going with that. And the reason why I say that, Carol, is because we have, again, just thinking about the number of wait lists for community services. In some cases, care partners, it's more convenient for them to attend a session over Zoom than it is for them to drive to a session and do an in-person session, because this way they can still be at home with their loved one, and they don't have to worry about getting somebody in to look after their loved one. So that's a consideration. Although in saying that too, I understand that the value in the in-person sessions, that when you facilitate a workshop in person, whether it's an active living workshop or whether it's a learning series that we put on, those connections those conversations continue to happen even at the end of the program. So they're walking out to the parking lot together. And exchanging phone numbers, or going to the coffee shop, or going out for lunch together. So that's the value of doing in person. Now, it's really a toss-up, because we have to determine how many care partners would be interested in going back to in person to make it viable. Right? Or would you prefer just to do Zoom sessions? So now that has been offered to us, right, to do the Zoom, does that make sense?
And what I'm hearing you describe is where a lot of organizations and they're looking at mixed models where, COVID, for all it has been awful, it has taught us a lot and created opportunities for linkages we may not necessarily have thought of or used. And for some, they're still going to do a mixture of using the technology as well as the in-person. And it sounds like that's kind of, you're just in evolution, you're in transition at the moment.
And it really is. And what is it that our clients want? What is the best way to support them? We also tried a program, and this was through grant as well. What was it called? Connect. It was a Connect program that we have these iPads. We actually still have them available. So if anybody's interested, to contact the Alzheimer's Society. We have iPads that you can loan out, and they come with those little Wi-Fi sticks. So if you don't have access to internet, you can access the internet with the stick, and you can loan this out till the end of April, so April 31st. And that gives people an opportunity who aren't connected to get connected, which is,
it's really nice. I remember you mentioning that before, and even people could connect with their families, right? Just a way for them. And I thought what a superb idea that was, to be able to help at least people to see people's faces. It's not quite the same, but to see people's faces for sure. You mentioned about getting together for coffee. If I recall, before COVID, or just that there was a program where people would meet together in a restaurant and have coffee. Is that and I thought that was a neat way of socializing in an environment. Will you be going back to that?
I think we will. It's a matter of finding a location that would be appropriate for that. It may not be the same location that we initially had. So again, we're just really looking at what's safest for our client, because COVID is still here, right? COVID is still present. So so we don't want to let our guard down completely. And we realize the importance of ensuring that that our clients are as safe as possible and feel safe and secure in a space.
Sure. You've described programs that use volunteers. Where are you with your volunteer base now? Are you looking for more volunteers at this time? This is your chance.
So I mentioned, so we certainly do need more volunteers. Okay. And I'm we'd be looking at those phone visit volunteers. We'd be looking at even an in-home recreational volunteer. And that in-home volunteer would take the individual for a walk, or sit down and read a story, or ask those questions that the phone visit person I described earlier would do. Also, we use volunteers for office. So just doing office admin work, volunteers for a walk for Alzheimer's, volunteers for Minds in Motion. So, we have so many programs now that volunteers are certainly. What is your specialty as an individual? And we'll find your fit with the Alzheimer's Society. How does that sound?
I think that sounds great. And you would train people, correct? Like people may say, "Gee, I don't know that much about this," but you're trained.
Yeah. So that's definitely important, because of course you have to have some knowledge and understanding and confidence in supporting somebody with Alzheimer's disease. So we do the training to ensure that they feel comfortable in what they're doing. We don't just throw you into the activity.
So anyone who maybe has never had an experience either with a family member or a neighbor or anyone with Alzheimer's, that wouldn't limit them from becoming a volunteer.
Oh, no, not at all. Not in action. That would enhance. It enhances you as well, because it gives you a different experience, right? When you work with somebody with a diagnosis of Alzheimer's disease, you're working with just one individual with Alzheimer's disease. Everybody is unique in how this disease presents itself. So you really just expand your knowledge and understanding about the disease, working with a number of individuals. And just that gratification, I always say it's the connection that we make with individuals. So it's that sparkle in their eyes, and that makes you feel good. At the end of the day, it makes you feel good when you've made that connection.
Yeah. I can't believe how quickly our time has gone. Sandra, it's always a pleasure to talk to you. And again, for those who are listening or can pass the word on about the Walk for Alzheimer's coming up, and consider putting on your running shoes and grabbing a friend or neighbor and just going for a walk, support a good cause, and financially, of course, a donation as well. Thank you, Sandra. Please join us again, where maybe we'll have other topics, not just COVID related, in the future.
Oh, for sure. Thank you so much, Carol.
My pleasure. And thank you to our viewing audience for joining us today to learn more about programs and services available to you and to your family. Please join us again and take care. Stay safe, and thank you.
This program is brought to you by OHL Action Pack. Looking to see tomorrow's stars today? Follow the teams and players you want to watch. OHL Action Pack is part of the Rogers Super Sports Pack.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Are you the type who would keep going or stop? It's not easy to stop when you have an addiction. Legalizing cannabis won't stop addiction. It trivializes its consumption. Let's be vigilant. If you need help, visit portage.ca.
To keep the gateway to America's mainland open,
if I'm not certain this runway is safe, I am closing it down.
They've got to stay cool.
We have to be 100% certain, 100%